Hi, everybody. Today I am here with Kinsey Gilmore, who is a lactation consultant and nutritionist. For those of you who may or may not be familiar with my work, my name is Dr. Dawn April Ross, and I am the founder of the Thought Word Academy, and I provide counseling services of the metaphysical type through my website. And we are now starting a new group called Rising Tide, where we are offering all different kinds of services from the beginning of our womanhood as we move on through the years, and to give people an opportunity to be able to understand what all of our providers are offering. We have a series of videos. This is one of them, in which I want everyone to get to know Kinsey a little more about what she does and the services she offers. Today we're going to focus on just the lactation support, and then there'll be a follow-up video where we're going to talk about the nutritional support as well. So welcome, Kinsey. Thank you so much for your time today.
I'm so excited to be here. Thank you, Miss Dawn. I'm ready to dive in and get to know everybody and excited to help. Really, I love how you said it. Just, it is such a journey too, and getting that support. I'm currently a breastfeeding mom in my days of motherhood. So I feel really connected to my patients, and I'm excited to be here today.
So much, yes. And as you know, we've worked together because I am currently in the same boat, breastfeeding my son right now. And, I wanted to put this group together because I wanted to have a space of individuals that I've worked with personally, who I trust, who I respect, and who I want to share, them with everybody that I can, because it's so hard right now to find, good support system, to know who's real, to know who's not AI, to understand, who exists out there. So this is what I wanted to put together, and hopefully years to come, people will still be using these services and getting the help they need.
All right,
so let's dive in. Okay, so tell me a little bit about why you got involved in lactation support in the first place, and how, if anybody wants to work with you, why that's unique to what you offer as opposed to any other lactation consultant.
Yeah, absolutely. So I actually started out as a dietitian in a WIC office, which is women, infants, and children. So working with low-income population and just helping them through their nutrition journeys. And so WIC is unique because they offer lactation support. So I was like, you know what? Sign me up. I first became a CLC, which is a certified lactation counselor. And I was like, I got to know more. I got to learn more. I got to know more. I'm a learner. So I went ahead and got to become an IBCLC, which is an International Board Certified Lactation Consultant. So I fell in love with the boob world, is what I call it. Just navigating that postpartum period, watching mothers struggle really hardcore in the first days to weeks to months. And so I love to bridge that gap between nutrition and lactation. I think that is such a unique kind of cornerstone of motherhood, because they kind of go hand in hand. So I've been really lucky to find something I'm so passionate about. I feel like I don't even, it's not truly work. It feels more like I get to show up every day and help so many moms in the same point of life I'm in. What was unique too is I was a lactation consultant before I was even a mother. Once I became a mother, I also got very humbled and my advice evolved. So that was really neat to see my own experiences, which really helped pivot to what I offer as a lactation consultant. So I would say I specialize in, I would say 3 areas mainly would be oral motor function. So if a baby is preterm status, graduating from the NICU, and a mom desires to try and breastfeed. If I also tongue and lip tie, so if a baby has an oral tether, instead of running to an ENT to get it clipped with scissors, which is can be overwhelming. And for a parent to watch their child go through such a procedure, I like to focus on more of the holistic route of oral therapy and body work. If a tether revision if I truly recommend it after trialing, I'll look at other avenues with like a pediatric dentist that uses a CO2 laser. Both of my boys had tongue ties. I'm very unbiased because my first son, I had it revised with a CO2 laser. My second son, I did not. I went hard into cranial sacral therapy and infant chiropractic care, worked with a speech language pathologist, and we were able to avoid a revision. Another area I'm really passionate about in lactation that's unique if you were to work with me is I have a bottle refusal certification. So this is an interesting one because babies can do fine with the bottle for the first 3 months, and moms are going back to work at 3 and 4 months, and then all of a sudden they're calling me panicking, crying because they have to go back to work and their baby won't take a bottle. So I found this a lot in my practice, so I was like, you know what, I'm gonna go get a certification in it. And I have successfully helped, I think, 20 families overcome bottle refusal in the last year. So I'm really proud of that. The last one I would say would make me unique is, this was fun, cow milk protein intolerance and cow milk protein allergy. I'm seeing, statistics show only 0.5% of babies actually truly have the allergy, which would be like visible blood in the stool, also like anemia, and just really like weight loss issues in baby. I'm more so see intolerance. So baby is colicky, fussy. So I help moms navigate maternal diet elimination, and then also something called the dairy ladder of how to reintroduce dairy back into their diet that baby can accept. So those 3 areas are very profound part of my day to day. And I feel really confident in all of those areas.
Well, that's amazing. I mean, and I can only speak from my own personal experience with you that over the years, I struggled. I wish I had known you when I had my daughter, and I struggled for a very long time trying to get her, to nurse, which she eventually did, but, having a lower supply and, many, many challenges that I went through. And, I went through so many lactation consultants because many just were leaving the platform I was using, not because of anything else other than that. I had ones from the hospital. And I just want to mention that, I really noticed the difference in the level of support that you provide, your expertise, the professionalism. I mean, really, truly, I remember the first time, you were evaluating my son and I, and you were like, giving these stats out like it was a doctor in an ER, like, okay, he's got a, this degree angle and the tongue is here. And I was like, I don't know what she's talking about, but it sounds good to me, but really just, that intensity and, what you had already evaluated just in that first few moments that we were talking and you were watching, it was impressive. And, I know it's been nothing but excellent support, that I've gotten from you, and that your expertise is as excellent as it is varied.
I appreciate you saying that.
No, I mean it truly. And that's why I wanted to say, wow, when I find somebody who's good, it's like anything else in life. When you find somebody, like a good hairdresser or, a good OB or something, you're just like, oh, share with people, because these are things that are hard to find,
They are. I hold on to my hairdresser. I always like book my next appointment before my appointment ends because I'm like, I want to make sure I'm on your books.
Exactly. And so I really wanted to share this support because it is something that, a lot of women are not, bless you, sorry, I was sneezing. A lot of women are not aware of is that it can be so challenging. Me, myself, when I first had my daughter, I was like, okay, right, you just put them on and they trick you because you're in the hospital and they go on that first time and you think like, oh, this is easy, this is great. And then you get home and they're like, what? A boob? Yes. What's that? What am I supposed to do again? Mm-hmm. So, I think being able to having gone through it myself, being a mom now, and having clients who are going through these different struggles, and just having this awareness even before, had I known, I really feel like I would have been able to do things very differently the first time. I didn't know. So I want to give people that opportunity to know more in the beginning so that they can be ready.
I love that.
What do you think is one of the biggest misconceptions that people have about what a lactation consultant does?
Yeah. I feel like people's main experience with lactation consultants is in the hospital environment. And it is a hustle and bustle. It is, they're seeing 30 patients potentially that day between the NICU and labor and delivery and mother baby unit. And so they get this blanketed advice, right? 15 minutes per breast and, looks good, or if you're a second time mom, a lot of times those patients kind of get put on the back burner. So I feel like people get this advice from lactation consultants in the hospital and it doesn't carry them. It doesn't carry them when they're getting home and milk is coming in, or they don't know how to navigate clogged ducts or transitioning back to work. So I think one of the biggest misconceptions is that lactation consultants are just there to teach you how to latch in the hospital. And it is so much more than that. I worked at a hospital for 2.5 years, and the advice I gave then was so, surface level compared to the advice I give in private practice now. A lot of times I'll ask patients, hey, what was your experience like with your lactation consultant in the hospital? And I never want to dismiss the advice another lactation consultant gave. I'll try and reframe it in a way that may have actually made sense at that time. Like a lot of times they'll say, 15 minutes per breast in the hospital. Well, that might actually be okay. It's not terrible advice, but it's not rigid. You know what I'm saying? Babies are not robots. They do not do well with schedules. So at home, as your milk comes in, things might change. They might spend 17 minutes on this side and 5 minutes on the other, and that's considered normal. So
and I don't think that you don't produce the same amount of milk on either side either.
No.
So
slacker boob for real.
Yeah,
the slacker boob is real.
Yeah, and they switch sometimes. Like in the beginning, I remember having more on one side and then less on the other. And I know when he's done, I'm like, oh, that one's empty. Go to the next one,
Exactly.
And timing it would be insane. I couldn't even imagine.
I have people to get the advice to do the tracker apps from lactation consultants in the hospital too. And I am a more intuitive person. Like I like numbers being a dietitian, but there's a certain point that it's not worth their mental space to be so rigid about tracking.
And I think honestly, it's too much stress in the beginning to even be trying to do that, because you're going to baby wellness and they're like, how many pee diapers did he have? How many these diapers did he have? How much sleep did you get? You're already tracking all these things,
Yes.
And it's just, and I know, because I've gone both routes, like as you have. With my daughter, I mean, I have notebooks this thick of every single, how many ounces she got, how much I gave, how much weight she was gaining, what time she drank, when she didn't, how many diapers she had. I mean, all of that. And with my son, it's just like, he's fine, he's good.
Yes.
I have it in my head, it's enough. But I can see how people, if they feel comfortable, if that makes them feel more confident, okay, great. If that's going to work for you. But the feeling that you have to do it,
right.
is not something,
No,
and I like the fact that, and then I think you have a certain style, which I appreciate, because I feel like I do the same with my clients, which is, meet people where they're at,
Totally.
If this is what works for you, great, then let's make that work. And I one of the things that I think is also important that I wanted to, get your feelings on is that, sometimes people, like, as you said, the difference between the level of support that you can provide as opposed to what they may experience in the hospital, which, by the way, my first hospital visit, I didn't even know there was a lactation consultant. Nobody offered me that or even told me about it in the hospital at all. Now, granted, my daughter was born on Christmas Eve, so it was kind of a skeleton crew there. So I
Yeah.
don't know if there was anybody. I'm sure there was probably one somewhere, but she was probably overwhelmed, with what was going on anyway. But that being said, let's say somebody is familiar with, or somebody is like, they are having some struggle, or they're concerned about, having enough supply, or
Right.
the baby's not latching correctly, and they're on the fence and thinking like, well, I really want to book something with you, but I feel overwhelmed. What would be the one thing you want them to know, to say, this is why it's important, to get some advice, even if it's just one time for the first, I think afterwards they'll see the support and how much it can help to have you be part of their team. But even just, what you can offer if they're on the fence about if it's something they should do.
No, I appreciate that question. Yeah, I really go into it like it's not an all or nothing mentality. Like everybody believes like lactation consultants really everyone has to exclusively breastfeed, and that's just not the case for a lot of people. If you offer a solution that's sustainable to meet the patient's goals, then breastfeeding is then extended. That's shown in research. So does that mean that a patient's partner gives a bottle of formula in the middle of the night because mom can get more sleep because she's a lawyer and she has a 12-hour workday the next day? Absolutely. If that's going to extend your breastfeeding journey so we don't swing the pendulum and say it's just too much, then absolutely, let's do that. I think that my goal is whenever I see a patient, I want to help also bring them out to bird's eye view. A lot of times when people are coming to me, they're desperate. They're super desperate. And I've been there before, so that's fair. So after hearing their story, which by the way, I always ask their story. Like, what's your back? Like, how was your birth? Tell me about your pregnancy. What support system do you have? But also, I kind of help reframe maybe what seems like such a big issue to them. One of the classic ones is, I'm 6 days postpartum and I don't have any milk saved in the freezer. Well, tell me why you think that you need milk saved in the freezer. Well, I've got to go back to work at 12 weeks. Okay, we have lots of time to build a freezer stash, and believe it or not, we don't need to exclusively breastfeed plus pump 12 times a day like TikTok tells you to do. It's a lot. You can actually build a nice little freezer stash by casually pumping one, maybe 2 times here and there. It doesn't have to be so exhausting. I hope I answered your question. Oh, did I answer your question right?
I think so. I guess the idea is, if they're on the fence, to understand that if they're going to come talk to you, you're not going to be like, you have to breastfeed and you have to do it this way. It's going to be like, listen, what are your goals? And let me help you figure out how to get there.
Yeah, one of my most classic examples, just last week, I had a mom who had a stillbirth. She wanted to meet with a lactation consultant to safely wean because her milk came in anyways. So she wanted to make sure that she was able to wean down her pump sessions so she didn't end up with mastitis after such a tragic, thing that she went through. Her and her husband were in my office bawling their eyes out. So my goal for that family looked very different than my first consult with most patients. But like you said, you have to meet them where they're at and their goals.
Right. And I think I think one of the things as well is that people who don't necessarily know even what it should look like, let's say, I think to give them the space to figure it out for themselves of what that is, because I find it can be very intimidating, in many ways, in both directions. I've had clients who straight up in the hospital had a nurse walk in and just hand them, a thing of Similac and be like, here you go, because this, basically giving them that idea that this may not work and, you're going to need this backup. I've had people who have just felt, I mean, myself even, I mean, when I ordered the medical grade pump and it came with these just bags and bags, like huge bags, I was like, who's filling these? Like, how is this even possible? Like, it just felt, overwhelming. And this pressure of like, I can't fill up that much, or if I get so little, it felt like disappointing. And I think also as women, from the psychological aspect, which is a lot of the work that I do with women who are going through this phase, is to be able to give yourself that grace of, you're doing the best you can. And I remember that mantra with my daughter being, any ounce is gold and any drop is gold, and anything I can give her is, it's not about the quantity, it's the quality that she's getting it at all.
Yes.
And I think a lot of times people need to hear that and need that support and understand, because, as we're going through a lot, our hormones are crazy.
Crazy.
It takes 6 years for your hormones to regulate back after giving birth.
That's
so,
insane.
And people are expecting it like in a couple months. No, that's not happening. So already you're just giving birth, and maybe you're also going through whatever your birthing, experience was, maybe a C-section, maybe something traumatic, whatever it was, you're healing, you have this living thing that you're trying to take care of and just keep alive. That's what my goal was every day. It's like, just keep everybody alive. At the end of the day, it's successful if everybody makes it.
Everybody's alive. It's true. And breastfeeding is just one part of your journey of motherhood too. Like, I know there's a huge emphasis because it is how our children grow. There is that pressure. But I always like to remind my moms, it is just one part of this massive motherhood journey you're about to embark on. So I love what you said about celebrating every victory of what you're giving your baby, because it is a sacrifice. Breastfeeding, pumping, providing, it's the most rewarding sacrifice I could think of.
Yeah, and at the same time, I think if a mom says, well, this is the best I can do, or these are the times I can't, whatever, but you know what? I think my personal feeling, and you can tell me what you think about it, is if a baby is crying, if a baby is in need, and you pick up that baby and you hold that baby to you, skin to skin, if you put them on your breast or you're holding a bottle in your hand, but they're feeling that you're there to comfort them in need, I think that's the most important thing, and you do the best that you can, I mean, I don't think there has to be that pressure in either direction. Some of us, we have no choice. There are, plenty of moms out there, they got to go back to work. They don't have support. They need to have those hours. And you know what? That's, again, these are the things that as you said, there's so many things that are part of it. But, as a therapist, my thought always goes back to, if you're crying and you're in need, is there somebody who's coming to comfort you and hold you and give you whatever it is you need? That's what matters.
Absolutely. Like, you're the one taking care of the baby, but who's taking care of you? Who's helping support and uplift you? It makes me think of a patient that really sticks out in my brain. She had what's called insufficient glandular tissue. She knew this already because her first journey with breastfeeding was unsuccessful, and meaning she had a hormonal issue. It's very rare. It's not common. I've only seen a handful of cases in my whole career. So second baby comes along. Baby's 5 days old when I first met her. And I offered a solution for her called a supplemental nursing system. I don't offer it a lot. I offered it for her specific goals she had. She ended up exclusively breastfeeding for a whole year. Never had to ever offer a bottle because she put formula in a supplemental nursing system. Baby still got breast milk. In fact, there were times where we removed the tube and baby was just nursing at the breast and you could hear the swallowing, but she never had to stress about being measured against that breast pump. And for her, that was a super healing thing for her from her first journey. That's something I want to mention too, is even if you had a previous breastfeeding journey that was traumatic, like birth can be, there's something really healing about your next journey if it's well supported and educated. So,
and I have you to thank for that as well. And every day, I pump in the night now that my son's at an age where he's breastfeeding all day, but he sleeps through the night. And, my boobs are sounding the alarm. Whoop, we need to be emptied out. So I let him sleep. I empty them out. I have a huge bottle that's ready in the morning most nights. And, and my daughter, who's 3.5, she gets an ounce of it every single day. I just put it right in her milk, and I feel like I'm kind of repairing what I lost a bit, from that journey, having not been what I dreamed or hoped for, but whose is. I remember when I met my OB and I was getting ready for, I got pregnant, and she said, "You can make a birthing plan." She's like, "But don't plan to stick to it, because you don't know what's going to happen."
Yes, it's an unknown. Breastfeeding is as much of unknown as birth can be. It really can. But there are some tricks up our sleeves that we can offer a different perspective. But I'll always come back to, what does the patient truly want, and in letting them know what is normal too, and what's realistic. I'm never going to offer a solution to a patient that's unrealistic for them. So.
Yeah. And we try, and I've seen, look, and I want to mention as well, for those who are watching this video and may have seen other videos on my page, my son, it took him 6 weeks to finally get it and figure it out. And I spoke to a number of lactation consultants before I met you, and ones from the hospital that were coming to the house. We were trying everything, all the things you just mentioned as well. And many of them said, a lot of people would have given up by now, for those who would not give up, or who are saying like, "Oh, it's this much time, should I give up by now?" I say, don't. Just keep going. Use this support system we're creating. Find the people who can give you support, and don't give up, until and if you're ready and you say, "That's it, I've done my best," which, you're absolutely fine to do whatever you feel comfortable with. But if you feel like there's still that hope, I hope I can be that beacon of support to say, yeah, there is that hope. You can make it happen. I went to everything, all the evaluations, testing everything. What is it? Mental? Was it physical? Was it, developmental? Was it some kind of issue? And then, one morning when he did it, and I was standing in a weird position and holding him, and he started doing it. And in my brain, I was like, is this the key? Do I need to be standing on one leg to make this happen? I was literally, everywhere I went, I'd stand up and I'd put my foot up, and I'd be like, I think this is the thing that's working.
I think this is it. Yeah. That's actually hilarious. Yeah. Babies, I've seen some babies just find their groove with the moms that really, like you said, stick to it. It's funny, in my prenatal consults now, I always tell them like, hey, give it 6 weeks. So that's funny that it took exactly 6 weeks for him. That's usually because a lot of times patients need some type of benchmark of like, okay, do I try for a day or do I try for 2 years? And I'm like, let's try for about 6 weeks, to see if breastfeeding is right for you. That encourages patients not to give up so early, because at least we could get a milk supply going during those early hormonal, I call it ride the hormones, because your postpartum early hormones really do help kind of establish that supply.
Yeah, for sure. Well, listen, I know you've got to go. I want to be respectful of your time.
I could talk all day long. This is so much fun.
It is, and I have so many more questions to ask. So I hope maybe I can invite you back, and we can do another continuation. I know we already talked about doing some of the nutrition as well, but I think there's also more to ask. More that we can talk about, and I'd love to create more of this dialogue, and then invite people to maybe send in some questions that we can answer as well.
So much fun.
And get people on board, and see. So right now, as of the taping of this talk, how can people get in touch with you if they need your support in this?
I'm always open to doing like if someone just has like one quick question. That's on my website, milkymamas.net. under the contact page. If they just, have one quick question, there's a way to just message me. I do respond to them. I promise that it doesn't just go to empty land. I do respond to them. And I'm seeing in person. So through milkymamas.net, you could book an in-person consult with me right now. And I would be happy to help assist you through your journey. And then, like you mentioned, nutrition, there are nutrition options as well. I can do those in person or virtual. So,
Okay, fantastic.
yeah,
So, thank you again so much for your time. I really appreciate it. It's been fabulous chatting with
fun.
you. I always learn so much every time we talk.
Yay.
And, I encourage everybody to just reach out, to have a conversation. Do you do like a consultation with people too, if they want to get to know more about you?
Yeah, I can offer a consultation. So if someone needs like a 15-minute consultation, that's absolutely something I can work out with them. If they just message
Okay.
me, I would love to support them and just so sometimes people just need to know, hey, is this for me?
Right. Okay. And so, again, right now, as of this recording, you see people in person, and you are on the west coast of Florida.
Yes,
You
in
are the
a small
Panhandle.
town, yeah, called Marietta, Florida. I have a lot of people travel from like Tallahassee and Panama, Pensacola. I had someone travel from Alabama last week, even. So just
Wow.
would love to see people in the Panhandle area in
Okay.
person. But
Fantastic.
excited maybe one
Wonderful.
day to do virtual. So
Yes, yes. Well, and we will update when that happens right
yeah,
here so people will know how to get in touch with you that way as well. So, again, thank
yay!
you so much, Kinsey. I appreciate you and
Yes.
everything that you do.
Thank you so much, Don. I appreciate what you do as well. It's very fun to see the full circle of things as well. So, all right,
All
enjoy your
right.
day.
Thanks so much. You too.
Bye.